Sign you are depressed to do anything. Situational depression can become clinical depression. 6 signs of high-functioning depression, Katie Morton. Situational depression and clinical depression are similar, but not the same. Situational depression results from a traumatic or stressful event and the inability to accept the changes that accompany it. This type of depression usually appears within 3 months of the event or change. Although clinical depression is more serious than situational depression, it is important to note that no type of depression is more real and manageable than other types of depression. All types of depression are mental disorders with complex emotions and conflicts. In clinical depression, the main symptom is almost always a long period of low or depressed mood. Feeling depressed often interferes with your ability to work, sleep, eat, and have fun. People with situational depression usually notice an improvement in their mood days or weeks after the stressful event is over, or after enough time has passed. However, if the events that trigger situational depression persist, or if a person does not fully cope with it, it can later lead to clinical depression. Many people believe that symptoms of depression are primarily mood-based, lack of pleasure, negative outlook, low self-esteem. Major depression is another situation. In case of major depression, it can affect energy levels, concentration, appetite, bodily vigor and sleep patterns. Serious biological changes are occurring in your body, including changes in hormone levels, sleep cycles, and brain structure. When this happens, you can't even get out of bed, let alone work a productive 8-hour day. So when you suffer from depression, your whole body experiences depression. Sadness and motivation. Depression. Another reason we lose motivation is sadness. Being close to someone who has died can lead to a variety of problems. Sadness can lead to anxiety, depression, and lethargy. Also, grief is not as black and white as the model of grief makes clear. Experience an emotional roller coaster. One day your sleep pattern may be disturbed and the next day you may have social anxiety. You may even have a good day and feel sick the next day. When it comes to treating grief, you may be wondering what's a good idea. There is no way to get over loss and people deal with it in different ways. But when grief becomes a health condition, lasts long, and affects how you make money and live, it's a problem. Seeking grief therapy can make a world of difference. If you imagine yourself feeling depressed, a therapist can help. Peer support and people who can empathize with what you've lost are also good steps. Grief can change in minutes, days, or even weeks if not days. Asking for help can stop the vicious cycle of sad times of the day. Feelings for the lost person are always present and upsetting for a long time, but a therapist can help you get back to a normal life. Depression can be a symptom of other mental health issues. If you first consult a doctor about your mental health because you are in a bad mood or have suicidal thoughts, your doctor may recommend treatment for depression without knowing you have other symptoms. If you think you have other symptoms, talk to your doctor so that you can get proper treatment. What to do when you don't want to do anything? Too depressed to do anything. Assess your symptoms. Everyone experiences a lack of motivation from time to time. On days like these, you may feel tired, irritable, or unable to rekindle your usual interest in things you normally enjoy. It could mean that you are under too much stress or are trying to cope with something unusual in your daily life. It is not serious. They may indicate that you need to step back, take a break, and give your mind and body a rest. A persistent feeling of wanting to do nothing can also be a symptom of a more serious problem such as depression or another type of mood disorder. If you lose interest in things, or lose interest in life in general for more than 2 weeks, see a doctor. If these feelings seem like a temporary state of mind, there are a few things you can do to feel better and regain your motivation. How can you know you have depression? These feelings are perfectly normal. Recognizing the symptoms of depression is important. That way, you can recognize when your emotions have moved into more toxic territory and take action if necessary. It's also important to recognize that your feelings may be work stress rather than depression. In principle, you should be able to identify the causes of stress at work. For example, an upcoming presentation, a tight deadline, or an especially long day at work. When that trigger goes away, the stress should go away. Depression, on the other hand, is characterized by increased feelings of sadness and guilt without a clear explanation. You may also lack motivation and focus for your role. Call your doctor. It is important for people who are chronically bedridden due to depression to pick up the phone and call their doctor. If you are feeling depressed, please ask for help in coping with it. Please contact your healthcare provider. You won't regret it. Don't miss how to tell your doctor about depression. Be aware of other mental health symptoms. Depression often doesn't get better without the support of a mental health professional, so we recommend that you consult a mental health professional. If you have any of the following symptoms: persistent depression, loss of interest in things you normally enjoy, indifference to most things, low energy or fatigue. What can you do when you are depressed? Participate in fun activities such as games and social gatherings. Avoid spending long periods of time alone. Eat a healthy and balanced diet. Be careful. Pamper yourself. Break tasks into smaller chunks and spread them out over time to make them easier to accomplish. Spend time with friends and family. Talk to someone you trust about what you are going through. Postpone important decisions until you feel better. When making important decisions, discuss them with others. Because depression can cloud your judgment. Seek professional help if necessary. Remember, no matter what you do when you're feeling down, it takes time to feel better. It may take several weeks of depression treatment before you feel better, but trust that your depression will subside over time. You may like, best ways to treat depression. What to do if you're too depressed to get out of bed? Do you think the world would be a better place? No. It's time to get up and get on with your life. It would be worth it. I promise. But what can you do to give yourself the energy to get out of bed? People at high risk for depression. People at highest risk of developing depression include women, older adults, those with a personal or family history of depression, chronic stressors, and other people with concomitant mental and physical health problems, people of low socioeconomic status, and people taking medications that can cause depression, such as contraceptives and anti-anxiety medications. Don't miss the best ways to deal with depression. Too long to be sad. Sadness is a normal human emotion. We all get sad sometimes, especially when unfortunate events happen or things change. It's still sad, but if you can get up and get dressed and go to work every day, how do you know it's crossed the line and you need help? And if situational depression has been going on for weeks and you're not seeing any progress, it may be time to talk to someone who can improve your coping. Talking about your problems and feelings with people you don't have a personal relationship with can ease your recovery and help you identify triggers. Professional therapists understand that it can be difficult to talk about what you are going through, but they will not judge you or rush you. The therapist can help determine if what you're experiencing is just a nervous breakdown or something more serious. And just because the world is in the grip of a pandemic doesn't mean it has to suffer in silence. People go to therapy for reasons big and small. Depression is like looking at life through a keyhole, explains Ehrman. When you can only see your problems and conflicts, you lose perspective in everything that is happening around you. A severely depressed person has lost the ability to imagine the future. When you start feeling this way and sadness takes over everything, it's a red flag for help. How can cognitive behavioral therapy help with depression? CBT uses cognitive and behavioral strategies to target thoughts, feelings, and behaviors associated with depression. Cognitive strategies that help with depression. People with depression commonly have negative thinking styles. They often feel that they are worthless, that the world is bad or unfair, and that they have little hope that their lives will improve in the future. I often blame myself, but when good things happen I tell myself I'm lucky. They are also less likely to recognize and appreciate positive events when they occur, instead being more attuned to the bad things in life and thinking about those events. It helps people identify and correct this biased way of thinking. These strategies can identify and sometimes question hidden assumptions and beliefs and redefine the way we think about life. When depressed patients are able to reformulate their thoughts, they can recover more effectively from failure and recognize and appreciate the good things in life. These skills have been shown to reduce depression relapses and relapses. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.